saúde dos doentes quanto à infecção do COVID-19.
Hello, everyone. Across the world, there has been a confirmed coronavirus disease of over 1 million. This is the latest figure from the Johns Hopkins University. That pandemic has resulted in over 53,000 deaths so far. In Africa, the pandemic has hit over 50 countries with more than 6,600 confirmed cases. And Mozambique in Southeast Africa has reported 10 confirmed cases. And today, here, the medical experts at West China Hospital of Sichuan University are holding an online training program for their counterparts at Maputo Central Hospital. As you can see, this training session has just started off. There are 3 keynote speakers briefing their counterparts on the latest developments and their working experience of coping the COVID-19 to their counterparts in Mozambique. And they're going to cover 3 different topics. The first one is the management of COVID-19 treatment. And now the speaker, Mr. Zhong Zhiyong, the Chief of Infection Management Department of West China Hospital of Sichuan University, is now briefing the management of medical staff and patients. And shortly after that, there's another speaker will brief the Mozambique counterparts on the diagnosis and treatment of COVID-19 cases. And today, joining me in this live is Associate Professor Mr. Li Hong from the Center of Infectious Diseases of West China Hospital. Welcome, Professor Li. Can you first introduce a little bit about yourself?
Yes, so I'm Li Hong from Infectious Diseases of West China Hospital. As you can see, then the experts from our hospital are discussing with Mozambique for the prevention, for the policy, and also for how to control, how to prevent the spread of COVID-19 in the world.
Okay. Now, as shown on this presentation slide, you can see the language is in Chinese and Portuguese. So we need you to explain a little bit because you are a medical expert. So what do you think of the main channels of transmission of COVID-19 virus?
And I think that most people know that the main transmission for the COVID-19, the transmission route is droplet and contact. And so then the hand hygiene and also wear mask are key for the prevention of this disease.
Yeah. So, Professor Li, I know that you personally have also taken part in COVID-19 treatment. Yeah, can you tell us more on that? How's your work?
I think for this is a virus disease. It's not a bacterial. So for bacterial, you can use some others. You can easily control. But for virus, we don't have very efficient medicine to treat this. So for the severe cases, so the patients need to be managed in the ICU. But for the mild patients, I mean for the confirmed cases with mild symptoms, maybe need to be has to be isolated in an isolation ward to stop the prevention or to stop the cross-infection among the hospital and also in the public. So then you can see that they are discussing for the transmission because for the infectious disease, the most important thing is to prevent because we have no efficient medicine to kill the virus. So if you can prevent the transmission route, actually you can control the spread.
And also this airborne, I mean the droplet transmission, the main way, the aerosol transmission, right? So most effective way is just to wear facial masks. Anything else to prevent the transmission?
Like you mentioned, the most efficient way is to wear a mask and pay special attention to the hand hygiene. So there is a difference between droplet transmission and aerosol transmission. So if this disease is transmitted by aerosol, which means that the transmission route is very efficient, so it means that when a person comes by, they can get transmitted. But for droplet, it's different. For droplet is less transmissible than the aerosol. So the most important, the main transmission route is still the droplet and contact. So for the droplet, we need to wear a mask to stop the droplet. And for the contact, we need to pay attention to the hand hygiene. If we wash hands thoroughly and often, and we can prevent the disease.
Yeah. And also another key effort is just to stay at home to avoid this kind of social activities, to try to interacting with other people.
Yeah. And I think the general population are well educated now to stay at home and to avoid contact with others, just to stop the spreading. And also you can mention, as you can see, that our Professor Zhong Ziyong from our hospital, I think since the beginning of the outbreak, and he recommends the general population to stay at home, and also give advice to the authorities to make policies, and also to educate the general population.
Okay.
Especially for the, I think especially for the management, the regulation and the diagram for the and the diagram, all the policy regulation are key to stop the spread of the virus. So every step is important. So I can later on you will see on the slide the diagram.
Okay, so they're still focusing on how to avoid the contacts and further transmission of COVID-19, right?
Yeah.
Okay.
And you can see, because the general population, everyone is susceptible. There's no vaccine to this virus.
Oh, they're not talking about the most sensitive group of people that are easily subject to COVID-19 infection, right?
Yeah. So
I know that according to media coverage, there are many medical experts explaining to the public that the very young, children, and also the senior people are more susceptible to this COVID-19. Is that right?
I think the senior people, or the people with conditions, are susceptible to the COVID-19. But for people with healthy people, I think even when they get this virus, the clinical manifestation might be mild, and if they isolate themselves at home, they might kill the virus at home. They even don't need treatment. So another key question is, will the people, when they get covered, can they reinfect the virus again? So I think now the opinion is that within a very short time, say 6 months or 1 year, the chance to be reinfected with this virus is low. But it really depends on the person.
Yeah.
And now I think here they are talking about the one of the key measures to stop.
Maintain a normal order, right?
Yeah, maintain a normal order is to search the patients or to identify the patients and to isolate them.
把潜在的这个病人找出来，这就需要对病人进行几个措施。第一，监测。
I think now they are talking about the triage. What is triage? Triage is a pre-examination. So you need to measure the body temperature of the patient, and also you need to ask the detailed information of their epidemiological history, or whether they go to Wuhan, or whether they come back from a country with many cases. So you need to ask a lot of questions.
But now, as a major focus of COVID-19 fighting, is a heightened focus on the asymptomatic patients because they show no symptoms, but they actually contracted the virus. So that is a little bit difficult to screen out, right?
Yes, so both for these kind of patients, they do not develop severe symptoms like fever or chest pain or even cough. They have no symptoms at all. So it's difficult for us to identify them and to isolate them. So this is a difficult thing to do.
Okay, so the talking is still focusing on the screening procedure.
Yeah, screening procedure.
How to screen the potential patients with the COVID-19 from the general public, and the different procedures to follow. The first one is to monitor the body temperature, and the second is check whether they got a fever or not within the 14 days, right?
14 days.
Yeah. There's also, so what's the normal symptoms of a COVID-19 patients? Dry cough?
The dry cough and fever. That's the main two symptoms. So normally so you can see here is an emergency department of West China Hospital. Here is how we measure the body temperature. So this is a triage. So if the patient is having a cough, and then will be redirected to another point.
So that entrance on the left corner is solely for COVID-19 patients with fever symptoms. Right?
Yes.
Okay. Just to give you a little bit of background information, the medical experts here at West China Hospital of Sichuan University are holding an online training program for their counterparts of Maputo Central Hospital, the capital city of Mozambique in Southeast Africa, and West China. Yeah, this West China Hospital is one of the most popular and renowned hospitals in China. It has many different cutting-edge technologies applied in the inpatient, outpatient treatments, right?
Yes. Another very important procedure to control the cross-infection within hospital is to separate the patients from the health workers. So we have the specific passage for the doctors, and also specific passage for the inpatients and outpatients.
So as shown on this slide, the medical experts are now separating people with the different symptoms.
And you can see the distance between people are separated.
Yeah.
So then
usually what's the distance?
The distance is, I think, maybe
1 meter?
Less than 1 meter, I think.
Less than 1 meter?
Less than 1 meter.
Okay. So that's the safe distance to
Safe
keep
distance.
clear of COVID-19.
And you can see of the entrance of the hospital, of the outpatient building. So we have 7 channels to divide the patients. So each channel, so we need to measure the temperature, body temperature of the patients. If the patient has fever, it will be redirected to another point. Yeah.
说起来很简单，但实际上来说，因为门诊量实在太大了，大家也看到真实的情况。这个地方要做到所有的一级的这个 triage 预检分诊是不可能的，所以呢也造成了大量病人的排队。所以在这种情况下，如果病人很多，就只监测体温，然后让病人先进去，然后做到第2级的分诊，预检分诊。所以我们的预检分诊是。
So the triage is the initial phase to separate people with different symptoms out, right?
Yeah. And the second level is we detect then the patient is having a fever, and we would redirect the patient to a fever clinic for further detection. We will connect the sputum or connect the blood for nucleic acid detection of the COVID-19.
Yeah, like you said, now the procedure comes to the third phase, and they say, is this the last procedure for the triage?
Yes.
Oh, okay.
So level 1, level
So
2,
before they're
and
gonna
level
see the
3.
doctors.
Yeah.
Okay.
Triagem de nível 1 no portão da clínica e triagem de nível 2 fica na enfermagem do consultórios e a terceira é efetuado por os médicos.
And now the expert, Mr. Zhong Zhiyong, the chief of the Infection Management Department of West China Hospital, is briefing their counterparts at Maputo Central Hospital. They just summed up 3 different procedures in the triage phase. The 3-1, first at the entrance, the second one at the information desk of the nurse, and the third one is by the physician, the doctor, to screen out the patients and providing necessary treatment.
然后呢，最后变成了确诊的患者，就通过这个每日3次的主动监测体温发现的。
Para os pacientes internados também
As you can see that we use the room temperature detection. We actually identify one confirmed case of in a hospital. So actually that patient is actually visit his relative in the ward. And he was found terminal fever and then confirmed.
Okay, so because the family members, they stay together with the patients, they're gonna increase the chance of getting infected.
Yes.
Yeah.
So now we have a restriction for the hospital visit.
So here at West China Hospital, in the ward, only one family member
Only one family
allowed
member
to
is
stay.
allowed to stay.
Okay.
Just to reduce the spread.
Okay. And they can't change. I mean, the family members cannot rotate, right? Just one fixed person to avoid further infection.
稍微远一点是没有流行病史的，当时受到2个发热门诊，起到了非常关键的作用，在本次的疫情防控中。
E não sei se a clínica de febre no Hospital Central de Maputo não. E nós temos uma regra de estabelecimento de clínica de febre.
So Professor Li, it said that there should at least 2 different consultation rooms, right? So why is that?
So you can see that if you look at the structure of our hospital, so we have to separate. I think that to have one clinic is to separate the patients. Now the fever clinic is very close to our isolation ward.
Or just to streamline the procedures and reduce the unnecessary procedures to make it more easier and timely to get COVID-19 patients treated.
Yes.
Now they are talking about the measures to set aside a number of medical staff at the fever clinic.
后来病人数增多了以后就不看这个 hold 不住了，所以就配了2个医生。后来开2个门诊，最多的时候我们就增加到3个门诊。另外我们采用的是这个大练兵的方式，让内科医生、外科医生都能参与发热门诊，这也是一个普遍的培训。我们呢还曾经做过一个研究，发现这个内科医生和外科医生在这个分诊上，在漏检上没有任何的区别。另外一个非常核心的。
So, Professor Li, what do you think are the key challenges in this screening of fever patients during this procedure?
The change?
The challenges.
The challenge. The challenge is, I think the challenge is that you are facing so many patients. And also for the doctors, they are also facing the challenge of being infected. So as you can see that we're talking about different clinicals. We have surgeons, we have physicians to be involved for the examination. And also for the physicians or surgeons, when you are in the fever clinic, you need to collect the samples. And even if you are not aware of this of the procedures, you might get yourself infected.
So all the medical staff working in the clinic of fever patients should be protect themselves.
Yes. So you need to wear surgical masks,
And protective clothes.
protective clothes, and even wear goggles.
Goggles.
Yes.
epidêmico.
好，另外的话，这个发热门诊的话，因为有很多病人等待，我们最多的时候发热门诊一天看了240多个病人，所以应该有一个宏观的。
So sometimes within a single day, then we have 240 patients for the screening of COVID-19. So we don't have enough outpatient fever clinic for these patients. So we establish the tent to address this problem.
Yeah. So because the number is huge, they set up this special, the makeshift tent for them to stay inside and to just waiting for their turns to get checked.
Yes, and I also say in the tent is the one door is for in and the one door for out.
I think this experience should be very practical for those medical staff working in Mozambique, because compared with China, in terms of medical facilities, it's less developed. Because now currently there are just 10 confirmed patients, but for the neighbor, because Mozambique is really close to South Africa, where it has over 1,000, around 1,500 confirmed cases. So, due to the proximity geographically, the country needs to ramp up its medical facility to provide a more timely and effective treatment to potential patients, right?
Yeah.
E todos os pacientes suspeitos têm que seguir a rota certa para chegar às salas de exame, etc.
Now, after the fever clinic separation and treatment, now comes to the third part, is the isolating ward, how to isolate the suspected cases, and using this negative pressure ward. Right.
So now we have three different wards for the patients. So for the suspected cases, so one patient in one room. So for the confirmed cases, so all the patients are in the same room. And the third one is for we call it temporary room, for which patients are excluded as infected with COVID-19, because we know that within 14 days they have no symptoms, but we cannot guarantee, so we have a temporary ward for them.
So the temporary ward for those with the negative test results.
Negative test results.
And now we're talking about the isolation ward, the layout of the room. It includes the activity room, the medic's office, and the living zone, and also the preparation space for the medical staff.
然后进去了以后的话，就是进到这个潜在污染区，我们的类走廊，然后这是病室，就是红色的区域。这个流程呢，相对来说，
You can see the red area is contamination area. That's for the patients, and the yellow area is for the doctors working in the isolation room. But for the green area is a clean area, which is for other uninfected.
如果患者需要做手术怎么办？如果新冠的患者需要做急诊手术，最好是有负压的手术间。这就是我们华西医院的手术间的这个平面图，要非常仔细的去看它的手术间。我们的负压手术间设置在房间的末端，如果有专门做院感的infection control的人的话，应该仔细的看它的压力是怎么样形成负压的，应该仔细的看这个图。
So now they're talking about the layout of the operation room.
找一个专门的这个手术间，它的这个风向和它的
So the operation room for COVID-19 patients all negative pressure in order to avoid the outflow of the virus into the outer spaces. Yeah?
Yeah, so the operation has to be conducted in a negative pressure operation room.
So Professor Li, you told me a moment ago that you took part in the treating of COVID-19 patients. So what do you think are the most difficult parts for you to take control?
I think the most challenging is to identify the patients without symptoms. It's easy for use temperature to detect them with a fever. But what about the patients without fever, without symptoms?
Yeah.
That's the most challenging point.
Okay. And here are several key takeaways to Mozambique. First, they need to have the capability to provide a nucleic acid test, and the second one is to get enough materials like the personal protection gear, like the oxygen supply machine, the ventilators, and also the testing kits. And the third one is I think this is a must, right, for patients and the people accompanying them to wear facial masks. This is a very effective initial stage to stay away from COVID-19 virus. And the last one is that all the medical staff should be on high alert to avoid potential infection.
特殊的时期采取特殊的措施，有可能第一可能没有休假，第二可能我们需要工作很长时间，第三我们可能是外科的，需要去从事不熟悉的专业，第四个可能是不是。
Now it's talking about the management of a medical staff, like how to prepare the medical staff to work long hours for the special and challenging job, and how to prepare them and train them with special skills to cope with this pandemic.
Yeah, especially for the doctors working in the respiratory department or doctors working in the center of infectious disease, they might not have the time to rest. They need to get well prepared because the pandemic might last long.
感染者，因为还要回家。根据现在这个意大利的分析，大概60%的这个医务人员感染是自己这个社区里面感染。
No, they're talking about the self-regulation of medical staff, because it's quite probable for medical staff to get infected when treating COVID-19 patients.
Even for the 60% of the doctors are infected in Italy, 60% they're actually infected in the community, not in the hospital. So if they are infected, they should report themselves to the authority to get self-isolated at home. If they don't tell and they go to hospital to work, they might infect other healthcare workers.
No, they are giving some suggestions on how to choose personal protection gear. Yeah, like you explained earlier, the first one is the protective clothing, and also the hat, and also the
surgical mask.
Surgical mask, and yeah.
So for all personal staff working in a hospital, 3 items has to wear.
As shown on this slide, there are 3 different face masks. What are the differences?
So they are different. So for the highest level of protection is from the N95 mask. And
N95.
N95. The general one is for the surgical mask.
Okay. So what's your suggestion for the ordinary people in Mozambique? Which face mask should they choose?
I think I would suggest, if they have enough, I would suggest them to wear the surgical mask.
Surgical mask?
Surgical mask.
Okay. So like the one what we are now wearing, right?
Yes, it's a surgical mask.
Okay.
e se não tem, podemos usar máscara médica.
好，那么如果刚才我们有所有的人员的话，都需要带这3个措施。如果是预检分诊的这 triage 的地方，它就除了这个刚才说的3个以外，就是工作服、工作帽、
Now, all the working staff at the hospital should wear protective clothing and goggles.
Para os profissionais na triagem, além daqueles 3 vestuários, e estes profissionais ainda precisam de usar vestuário de isolamento descartável e óculos de proteção.
好，如果是在发热门诊或者隔离病房这个工作，因为它可能会采这个病人的呼吸道的咽拭子或者鼻咽拭子，所以呢就需要的话戴医用防护口罩，就是刚才说的 N95 口罩。
And here in the fever clinic, of course, the alert level is much higher. They suggest medical staff to wear this medical grade face masks.
And also goggles.
Goggles.
Yeah. And also
Because this is in fever clinic.
And also facial shield, which is help to protect the splashing of the sputum from the patients.
戴这个医用防护口罩以外，如果能够有这个正压的头套，那对这个防护的话就会可以做到
And you
更
can
好。
see the headgear, which we call
Positive pressure.
positive pressure headgear.
因为存在这个交流困难，所以像我们的很多的经验来看，这个不是最关键的。
E para os profissionais na UCI talvez precise.
So, Professor Li, what about the medical staff working here at West China Hospital? Do they all, when they work inside the fever clinic, they wear this headgear?
Especially working in an isolation ward, they have to wear this headgear.
So this is a must.
This is a must. Because in the isolation ward, the patients are confirmed cases of COVID-19.
这个标准以外，它还有另外一个分类叫3、4、5、6。一般来说，这个加上3或者4，可以用作这个
Well, this is really technical. There are several different types of protective gear.
它一般用于普通的这个，比如说发热门诊或者普通的隔离病房操作可以。
E essa norma é da União Europeia. Normalmente podem ver aquele símbolo IN 14126 e quando os profissionais precisam entrar no UCI é aconselhável usar vestuário de proteção.
So, Professor Li, we know that for West China Hospital, it is sent out like around 200 medical staff to the epicenter of COVID-19 in China, Wuhan city, right? And all of them returned without infections, right? So that is actually a very useful experience that they can share with the people in Mozambique to protect yourself. Even for medical staff, they need to stay on high alert and have extra protective methods.
Yes, active protective methods. So we still have many doctors and nurses working in Wuhan. So not all of them coming back. We still have some left working there. They are dealing with severe cases of COVID-19 there. They're still dealing with it. But I think it's really a good experience to share with others, especially with Mozambique, then how to prevent the doctors or the health workers infected by this disease. I think one of the most key is the resources. You need to make sure that every doctor or every nurse has the mask, or has the goggles, or has the protective clothing. If you don't have it, how can you protect yourself?
Yeah. So this is the most basic part of getting the public prepared and getting the medical staff prepared to cope with COVID-19, to have enough protective gear, the goggles, the face mask, especially the face mask, because this is used by general public. And in the initial phase of China's COVID-19 outbreak, there's a shortage of face masks, but within a short period of time, the companies activated their production procedure and to produce more face masks. And now that's enough, right, for this for within China, right?
I think so.
Yeah.
But I think in China, I think they actually control the disease spread within Wuhan. So they close the city, so then the confirmed cases do not go out, which is why now we have enough. We have enough masks. If we have too many confirmed cases of COVID-19, we might have a very shortage. We have a shortage of masks.
Okay, it's now explaining two wrong ways of putting on the face masks. The first one is to expose the nose. This is really wrong way to do that. And the second is to leave a gap between the face mask and the skin of the patients.
E tem uma regra de 2 antes e 3 após. Faz quanto possível, mais possível, higiene de mão.
好，还有很关键的一点就是要管好我们自己的手，尽量避免用手来接触我们的鼻腔、口腔和眼睛。
And now is the hand hygiene, because we know that one of the two main transmission route is contact. So we need to pay special attention to the hygiene of our hand. So we should stop using our hand to touch our eye.
尽可能用我们的上臂的衣袖来遮盖我们的咳嗽和打喷嚏，而不要用手，因为手具有强烈的不可预测性。
If we are sneezing, we should not use our hand to cover our nose. We should use the sleeves.
The sleeves.
The sleeves.
Okay.
好，最后一个呢，想到就虽然这个疫情。
So actually, all the suggestions here is very practical for daily application for the medical staff or general public. It's very detailed suggestions. And now this session, this topic is over now. Just now, Mr. Zong Zhiyong from West China Hospital briefed their counterparts in Maputo Central Hospital about the management of medical staff and COVID-19 patients.
E outras coisas, acho que devemos controlar bem essa epidemia. E essa é tudo o que queríamos falarmos por aqui. Muito obrigado pela vossa atenção.
好，谢谢志勇部长。那么下面我们请唐红教授
And now
讲
the
述新型冠状病毒肺炎的
Presider
治和
is inviting
治疗。
Ms. Tang Hong, Director of Infectious Diseases Center of West China Hospital of Sichuan University, to brief the counterpart in Maputo Central Hospital on the diagnosis and treatment of the COVID-19 cases.
大家好，那么刚才呢，我们2位专家已经给大家介绍了我们整个的管理和防控的一些流程。我刚才也听到了。
So this part is supposed to be very critical because it really deals with the matter itself.
I think now the Professor Hong Tang will talk about the diagnosis and treatment of COVID-19 patients. So it's very practical and how the health workers in the hospital, especially in Mozambique, to deal with this disease. And now they have 10 cases, right, in the hospital.
Yes.
And how to treat them is a concern now.
It has listed on this slide the different phases of the evolvement of COVID-19. It was first reported back in December 31st of 2019 that in central China's Wuhan city, there is a unknown pneumonia-like symptoms among local patients.
And I think for China, our response to COVID-19 is very rapid. Since the end of December 2019, and after within 1 week, we have isolated the virus and finished the genome sequencing of this virus. So because within a very short period of time, we finished the sequencing, which is very important.
Yeah, like just within 1 week.
Within 1 week.
Yeah.
And also the WHO is responding rapidly. In 12 January, named the virus as 2019 novel coronavirus.
Yeah, but the latest actually updated the name, like in February 11th, as COVID-19.
COVID-19.
Yeah.
And Professor Hong Tang just mentioned that 205 countries have been reported to have COVID-19 currently.
So now it's a global pandemic.
The global pandemic.
So that requires a global concerted efforts to fight this COVID-19.
It is. So it's not a country's disease, but it's a global disease.
Yeah. And I think that's why today the medical staff here is kind of holding this online training course to the Maputo Central Hospital medical staff. It's a model for us to work together to share our experience of fighting COVID-19.
It is. So then we can discuss, we cooperate to fight against this virus. If we stop the spreading in Mozambique, we actually stop the spreading globally.
So COVID-19 was declared as a pandemic on March the 11th, and then on April the 3rd, there had been over 1 million confirmed cases across the world.
The COVID-19 is one of the emerging infectious diseases.
Yes, this is why it's got a name, novel coronavirus.
Novel coronavirus.
It's a new type of coronavirus.
So I think everyone knows about the SARS. The SARS is also coronavirus. And for the MERS, Middle East coronavirus is also the coronavirus. But this one is a new type.
Yeah, there are different cases of
emerging infectious disease.
Yeah, it's all coronavirus, right?
Not exactly. We also have the.
Oh, SARS is
a type of
coronavirus. Yeah.
But we also have the flu virus.
Flu like H1N1. Yeah.
So for the SARS, we have the first case of SARS. We had the first case of SARS in 2003 in Guangdong.
Yeah.
E todas essas doenças causaram danos significativos.
这些新发传染病呢，都有一些共同的特点。那一个就是种类繁多，另外传播途径有多种多样。
Now Mr. Tang is now sharing the common features of those newly contracted infectious diseases. Right?
As it is novel virus, it is difficult to diagnose at the very beginning, and it is difficult to trace.
E tem algumas características comuns. Por exemplo, há grande variedade de espécies e os hospedeiros dos patógenos apresentam diversidade.
So, Professor Li, we're talking about the common features of this newly mutated coronavirus, these infectious diseases. So, what, if we are looking back at China's experience, what do you think are the key takeaways that other countries can learn from, and what do you think are the major experiences?
The experience, even for the SARS in 2003, and now for the current COVID-19 pandemic in China, I think the key message or the key experience is that the isolation at the very beginning.
这一次呢，实际上在中国的这个疫情防控工作中的话，在临床诊治方面，我们也是在摸索，在积累经验。所以说，我们中国呢已经有第7版的这种临床救治的方案。然后我们四川呢也根据我们自己的实际情况，以及我们救治
And
的
now
一些体
the expert here at Western Hospital has listed a table of content about COVID-19, and there are several topics to discuss in this training session. The first one is what is the COVID-19 virus, the coronavirus, and how the virus is being transmitted, and what are the clinical features of the infected patients, and also how to diagnose COVID-19 cases and how to treat it, and the last one, how to prevent the contraction of the virus.
Tudo quer dizer que nós estamos a acumular as experiências com o passar do tempo. Depois vou compartilhar as experiências que obtemos neste período.
那么，首先我们来看一下2019新型冠状病毒。冠状病毒呢是广泛存在的一个自然界，因为它奠定
So now here is a brief discussion about why it is called coronavirus. Because the virus, the shape is like a
crow.
Like a crow. But normally we use
quando observada sob microscópio eletrônico.
在既往已知的冠状病毒里面，
So there are 6 species of coronavirus, and 4 of them are less severe, cause less severe disease, and 2 of the 6 coronavirus are known. The first one is SARS, the second one is MERS. But for this one, COVID-19 is a new species.
Okay, so both SARS and MERS are the subdivision of coronavirus,
It is.
and so there are 6 different coronaviruses in the past, but there are only 2 of them are highly contagious.
Há 4 deles que apresentam baixa transmissibilidade e outros dois
SARS and MERS may be less infectious than COVID-19. So
Oh.
COVID-19 is more infectious than SARS, but I think it's less severe.
虽然它们在基因结构上有相似性，但是呢，还是存在明显的一些区别。
e há semelhança.
So what are the differences if you compare these 6 different types of coronavirus?
If you observe them under electron microscope, they might be the same. It's like a.
It's almost the same.
Like a crown.
Okay.
But why we define it as a novel one? Because based on the 4 genome sequence, they are different. So I think the isolation of the virus and 4 genome sequencing is key to define this new virus. So genomically, they are different. I think this information is also important for the general public to know about this virus and how to disinfect at home or in a hospital. So the coronavirus is very sensitive to ultraviolet and very sensitive to warm water. For instance, 56 degrees for 30 minutes we can kill the virus. Even for the 75% alcohol we can kill the virus.
Okay.
That's why in China there is a shortage of the disinfectant
So
in the pharmacy.
yeah,
People
the
get the
荷兰现在已经发现，它是主要是通过人的呼吸道、口腔和结膜的黏膜细胞上面存在的 ACE2 的
is now expanding
它的相
on
互作用
how
感染
the coronavirus
人的呼吸道的上面
is affecting human cells.
Como é que o coronavírus infecta as células? Proteína ACE2
and why the general population are susceptible to this virus. Because in our epithelial cells we have the receptor for this virus, which is called ACE2 protein, which is the receptor for the virus. So the virus can bind to this receptor and get into our lung.
就病毒感染以后呢，主要在这个肺的细胞里面。
So the ACE2 serves as a carrier of the coronavirus.
It's a receptor.
Receptor.
It's a receptor. Okay. So this receptor is existed in our epithelial
这
cells.
个目前根据目前观察的一个情况的话，以
So
前
now Professor Hontan is talking about the mechanism
它的
of the infection, how the virus get into our
但
body.
是呢，它的结构上面还是维持了沙士病毒 S 蛋白和这个受体的结合的原结构。因此的话，实际上现在这个病毒显示出来还是有非常强的这个传染性，甚至根据目前的报道的话，它的传染性实际上比 SARS 还要强，就现在显示出来。但是呢，
So what's the transmission pattern of COVID-19? It's only transmitted between people to people.
关系是非常大的。
Now it's
Anything
human to human transmission, so from person to person. But also if you have, but it's also reported that people found the virus in the feces. So I think maybe the fecal oral transmission is one possible route,
Okay.
but currently it's uncertain.
Okay. So that's why it's quite necessary to keep clean of your
Toilet,
keep the toilets and get it sanitized.
sanitized.
Yeah.
But also because it's uncertain, and I think the most important measure is still the wearing mask and hand hygiene.
Yeah.
Comparativamente baixa em comparação com a SARS. A taxa de letalidade pode ser alta se o tratamento não for rápido. Alguns países são mais de 10%, mas é mais contagioso.
关于这个新型冠状病毒是如何传播的，刚才钟志勇部长。
So the transmission rate among different countries shows a totally different result, right? So why is that?
传播途径和
I think
Is
maybe
it
different.
people's awareness for the self-protection or anything else?
在
One thing is people's awareness. The second thing is the country's policy or the surveillance policy. Because in China, I think we educate the public that when you go out, you need to wear a mask and pay attention to your hand hygiene. And also we have strong policy to isolate the patients.
Yeah.
这个一个是因为它是新发现的病毒，人群对就没有见过这个病毒，所以说对它是普遍缺乏免疫力的。第二个就是现在感染以后，
And now Professor Hong Tang is talking about why the general population or everyone is susceptible to this virus. Because this is a new virus. We human beings never experienced this virus before. So we have no antibody, we have no immunity against this virus. Whether we will have immunity after infection, we need some time to prove.
Okay.
But currently, so far, for the cases when the recovery, there's no there's no reported cases for as reinfected patient.
这个病毒感染以后，
So after they recover from COVID-19, they're not like infectious.
但多数
Currently, we don't know. It's uncertain.
Okay.
But currently, we can see that there's no reported reinfected patient. So it means that maybe after infection, their body might develop immunity against it, which means that they might never acquire the disease. But we don't know currently.
Okay.
Há 14 dias, a maioria.
So the incubation period is from 1 to 14 days. And for most of the COVID-19 patients, it's around 3 to 7 days.
Incluem geralmente
And most commonly 3 to 7 days.
Alguns pacientes com obstrução nasal, secreção toda de faringe e diarreia.
轻症的患者呢，可能只有低热、轻微乏力，没有肺炎的表现。但是重症的患者呢，我们这儿也观察到，有很多患者开始比较轻，在
The three most common symptoms for the COVID-19 is fever, fatigue, and dry cough. Or for some patients, they don't have any symptoms at all.
E temos de prestar atenção ao tempo de surgimento de dificuldade de respiração.
在体征上面的轻症可以没有症状，甚至我们现在也观察到有没有症状、没有体征的这种无症状感染者，但是呢，作为传染源，它还是应该引起我们的一个重视吧。就是这部分人刚才。
So it's talking about the different symptoms, like among patients with mild symptoms and those with severe symptoms, right?
But for the asymptomatic patients without any symptoms, it's a big challenge for the public health.
Okay. So
they might
then,
have a potential infection source.
Yeah. I think for China's effort to fight coronavirus, it's now shifted towards how to screen out these asymptomatic patients from the public, because this is now the main focus.
Now it's the main focus.
Yeah.
I think previously it's about the symptomatic patients for screening and for identification, but now they shifted from the symptomatic patients to asymptomatic patients.
Yeah. So what are the effective way to find them, to locate them?
I think the efficient way is that
Because they have no fever, no symptoms like a dry cough, like a chest pain.
my personal experience that if you have enough detection kits, you can detect.
Okay. Just go test it. That's the most direct way.
If you want to know whether you have it, you test it.
Yeah. Yeah.
If you have the kit. Or if you say you are exposed to a confirmed case of COVID-19, and then you go to the hospital, you get yourself detected. But now I think we don't have, maybe we don't have enough detection kit.
And also, I think that the most common asymptomatic patients actually from those regions with very high occurrence rate of COVID-19. So it's quite possible when you have close contact with COVID-19 patients or suspected cases, you need to, just like you said, to take this test before it developed into obvious symptoms.
Yes, that's why I think that in Beijing, if you come from overseas, maybe you need to get yourself isolated for 14 days.
Yeah. And like in Mozambique, there's now like 10 confirmed cases. If the general public have contact with the patients, they need to report themselves and then get a blood test of those COVID-19 virus. Right? Yeah.
在病原学检测上面呢，主要是采取 RT-PCR 的方法，或者是直接特序的方法。当然，我们更多的是用的这个 PCR 的方法，因为它简便快速。对于这个鼻咽拭子或者是痰或者是其他的下呼吸道。
No, the speaker is focusing on the laboratory tests, the blood test, and the blood biological chemical test.
Quanto ao exame etiológico, nós utilizamos no momento os métodos PCR e também fizemos esfregaço nasofaríngeo.
I think for the confirmation of COVID-19, it's from the microbiology test. Then it's nucleic acid detection of the virus or the genome sequencing of the virus. But if you don't have it, maybe at the very beginning we can have a blood test. I think the reduced level of white blood count can be a sign.
主要的表现呢，还是与其他病毒性肺炎有相似的地方，没有完全的特异性，但是也发现一特点，主要早期是多发的这种小斑片和电子改
The
变。
imaging character of the COVID-19 is not different from other viral pneumonia, so it's mostly the same. if you want to confirm this, you need to have a detection of the nucleic acid test.
还有就是在疾病的过程中这个肺部影像学的。
So this CT scan is actually just supporting method. Should be accompanied first by the nucleic acid test.
It's one of the features of the clinical manifestation, but it's also very important detection. With the CT scan, we can show that it's a viral pneumonia. It's not bacterial, it's viral. So you can see that if we have severe cases, we might have a consolidation of the lung.
Yeah.
E desenvolvimento de uma imagem de vidro abrasivo de ambos os pulmões, uma imagem de infiltração e, em caso grave, uma deformação pulmonar firme, sendo raro o derrame pleural.
I think West China Hospital is pioneering other medical institutions in China by incorporating 5G technology in conducting this kind of remote CT scan on patients.
Yeah, I think the 5G technology, especially for the remote areas, so we might have the consultation from experts to diagnose the patient and for the efficient treatment.
So it's quite possible that for the medical experts here in West China Hospital, they can conduct remote testing on the patients from Mozambique, from other countries,
Especially
if
for
the technology supports, which requires very stable telecommunication signal, and they can also use the cable signal.
Yes.
Yeah.
For instance, if the patient have a CT scan, and then you can send the CT scan, and then the experts from Western Hospital can actually discuss.
Epidemiológico.
我想，对于你们国家来说的话，可能主要流行病学上面就是一个要考虑，就是有没有境外的这种疫区回来的这种接触史，还有就是如果已经给感染者检测阳性，
Now, Professor Huntang is talking about the diagnostic criteria for COVID-19, and the first aspect is epidemiological history. So you need to ask the patient whether you have traveled to other area with a lot of confirmed COVID-19. So this needs the doctors to ask the patient. And we normally ask for 14 days. You say within 14 days, have you ever traveled to other area? Because the incubation for the COVID-19 is mostly within 14 days, and mostly 3 to 7 days, within 14 days.
14 days is regarding the maximum duration of incubation.
You might hear from some report that some people get a positive test maybe 20 days, but that's rare cases. Most people they develop symptoms within 14 days.
It's not how to treat confirmed cases.
For confirmed, you need the nucleic acid test.
So what's the most advanced testing kit here at West China Hospital? Any cutting-edge technologies being incorporated into this mechanism?
I think our hospital, we developed ourselves the kit for the detection of this virus. But I think maybe with the passage of time, we might even develop more, even quicker detection.
Sequenciação de gene do vírus em amostras de via respiratória ou de sangue.
So how long will it take to get the results of nucleic acid test?
It depends on the connection of the sample. So for instance, when in a fever clinic, the doctor connect the sputum from the patient. You need to send it to the for detection. It might take quite some time.
So they're talking about the classification of clinic cases. So usually, what are the the different types of the confirmed cases.
So there are
Clinical
four of
practice.
them: the mild, common, severe, and
Critical.
critical.
Classificação clínica e dividimos em quatro tipos: leve, comum, grave e crítico.
So what's the difference between the mild ones and the common ones?
You can see that for the mild ones, you even maybe don't have symptoms. You have no fever, no dry cough, and you have no symptoms at all from the imaging, like the CT scan. You don't have any sign of pneumonia. For the common ones, you have fever and you have dry cough. And then the CT scan suggested that you have a viral pneumonia. But for severe ones, you might have a difficulty in breathing.
As explained by medical experts here in China, actually over 90% of the confirmed cases can heal themselves. Is that true?
Yes, that's true.
Oh.
Especially for the elder people and also for the people with conditions, and they might develop into severe or critical COVID-19. I think that's also the basis why we suggest that the public you can self-isolate at home.
So people will eventually heal themselves for certain group of people.
For certain group of people.
With a high level of immunity.
Yeah. But if you have a difficulty in breathing, you have to go to the hospital. Or if you have fever, you have to go to the hospital.
Okay.
To get yourself detected.
But self-isolation is the top priority because even though you show no symptoms of COVID-19, you can still infect others, infect the people around you, and putting them in a very dangerous situation.
Yeah, it's because even for the people without symptoms, if they have the virus inside their body, they can still serve as an infection source. So that's why self-isolation is very important.
I think it can be extremely dangerous for those with complicated symptoms, like they have contracted this COVID-19, and at the same time they have other kind of diseases like high blood pressure, like other diseases like diabetes, things like that.
Yes, in that case, it might be very complicated. For instance, the patient already has a bacterial infection, and then you have COVID-19, which makes the treatment much more complicated. For instance, if you have a cardiovascular disease, and then you are infected with COVID-19.
Tudo isto baseado no exame etiológico.
最后，我们再来看看怎么进行一些治疗。总体的治疗原则呢，刚才两位部长也讲到。
Now comes the practical suggestion how to treat infected patients. So, Professor Li, can you explain us the key takeaways from this treatment suggestion?
No, I think that's just the beginning of the treatment, talking about the treatment of the patients. Now is the principle. So we may need many groups from different departments, experts to discuss how to deal with the patient. Especially, we think that the treatment need to be individualized because each
to avoid cross-infection.
To of course this cross-infection. So the patient need to be treated in a hospital with the isolation facilities because for some county level hospital they might not have the isolation facility, they might not have the ICU. So we strongly suggest that for the patients should be treated in people with these facilities.
Okay, because previously, I think most of the countries across the world were not fully prepared for this pandemic. So now the country is now starting to build these temporary hospitals at converting stadium or some public spaces into the temporary ones, right?
Yes.
So this is one of the effective ways to put all the infected cases together for a treatment, for a timely and effective treatment.
Yes. So then you can, so then all the suspected and confirmed cases are gathered in the temporary ward for isolation and for treatment.
Yeah. We just missed one point. Actually, for the severe cases, they should be immediately sent to intensive care units for more professional treatment and care, right?
Especially for the critical, for the.
So this is very important.
Yes, for people with in critical condition.
Or here are some practical suggestions for the common symptoms. I think now it's about the medication.
It's about medication, about antiviral treatment. But if you say it's a virus infection, if we have the medicine to be specifically against this COVID-19, then we don't need to worry about. But I think currently we don't have the efficient medicine to treat this disease. But we are trying different drugs. We are screening different drugs.
Yeah. So in clinical the treatment procedure, what are the most effective medicines so far? Because the different antivirus medicine to choose from. So which one is the most effective? Like here in China or here in West China Hospital?
This is a very difficult question. We currently can't say which one is the most important one or which one is the most efficient one because the treatment for the patients is individualized. Maybe for this patient, he is well responsive for the interferon, or for another patient, he is well responsive for another drug, which is different.
So it depends on the specific cases.
Specific cases.
Okay.
If we have the evidence from the randomized controlled clinical trial, we might be able to find the most efficient medicine to treat COVID-19, but so far we don't have. So you can see from the slide we have different drugs currently being used for the treatment of COVID-19, but the experts suggest that you should not use 3 of them together for the treatment because every drug has a side effect.
Okay.
If we observe intolerable side effects, we need to stop the medication immediately.
So which one of the different choices of medicine is the most commonly used for treating COVID-19 patients?
I think you can see that the first one is interferon, and the second one is lopilavir. So I think Professor Hongtan will introduce one by one.
Okay.
And the first one is interferon. So interferon actually is a wide spectrum antiviral drug. So at the very beginning, I think medical doctors are using this one.
E o interferon é o medicamento antiviral do amplo espectro.
Yes, normally we use interferon for the treatment of chronic viral hepatitis, for hepatitis B and hepatitis C, which is very infectious. So now we are using this interferon for the treatment of COVID-19. We don't have experience before because this is a new disease.
We are still,
We are still accumulating experience.
Okay. So this is all the experience shared here is after the different tens for different phases of trials, and most of them have been proved effective. So that's why the medical experts here are sharing the experience with, with the people in Mozambique, in Africa.
The second one is called lopilavar and ritonavir, which is actually used for HIV. So,
比如说普通影像重症的转变，这种还需要观察。
So I think the experts worldwide are using or screening different antiviral currently we have to test whether they are effective for COVID-19.
So what about the traditional Chinese medicine? I think according to the health authorities, almost all of the patients have taken the solutions and of traditional Chinese medicine. So is that TCM effective in coping with COVID-19?
I think for the TCM, for the traditional Chinese medicine, it's like you have different herbs together, and some of the herb, the element of the herb have antiviral effect. But it's difficult to say which recipe is the most efficient. So we're still comparing the experience from different recipes.
实际上大家都非常清楚，可能最近在国际上也是报道比较多的在使用的，就是它因为是一个对疟疾的治疗的药物，也可以治疗这种阿米巴病。同时的话，它也是一个广谱的有一定抗病毒作用的药物，这个是有报道。因此呢，这次在我们的方案里面也得到了一个推荐。当然也有报道是用硫酸。
So what's the key feature of this medicine?
So this one is also an old drug which is used for the, how to say that one?
Malaria.
Malaria. But also it has some side effect. So in using this drug against the COVID-19, we need to pay attention to the side effects. We say that we can only use this drug for 7 days.
So this is a typical anti-malarial medicine.
Yeah, it's typical one. So we are now using this one to treat COVID-19.
So it's been successful.
Some things are successful.
Okay. So I know that in certain countries in Africa, like in Sudan and several other countries, there's a fixed pattern of malaria occurrence, and there be a huge effort being invested to produce high quality anti-malaria medicine. So even for people there, they need to have a very discretionary attitude while choosing whether to use anti-malaria medicine to cure COVID-19 or not. So they need to consult to a doctor first, right?
Yes, they need to consult a doctor first. And this one is called Abidol. This one is used for flu disease, and they are now also being used for cope with COVID-19.
Mas ainda estamos à espera os resultados do estudo e análise.
还有一些其他的研究方案，包括这个Ravage 这个药物的话，可能大家比较关注，因为在美国的第一个病例报道了同期用药用了这个药显示了疗效。当然我们国家
Are there any other solutions?
This is also which is developed for MERS, coronavirus. So now it is being this experiment is being going on clinical trial in China and also in the US to see whether this drug used for MERS coronavirus can be effective for COVID-19. So it's a phase 3 clinical trial being going on in China and also
So the third phase is the final phase? Yeah, that's the final phase of trials?
Yeah.
investigação clínica também foi iniciada a nível.
So this medicine, the remdesivir, is that available here at the West China Hospital?
It's available in China for the clinical trial.
疗法的潜在药物和疗法的话，都一定要经得起临床实验的验证。但我们也非常希望，我们国际社会的。
So you can see that Professor Hong introduced or talked about different types of drugs for the treatment of COVID-19, for antiviral treatment. But which one is the most effective one? Currently, we have no answer for this. We need to wait.
Okay. So before a vaccine is developed in the near future, so all these different medicines can be used, but in a cautious way, right?
In a cautious way, yes. We might use one single drug, we might use a combination of different drugs, but we have to use in a cautious way because each drug has different side effects.
And here, on this training session, the medical staff here at West China Hospital are actually sharing the experiences accumulated from this the clinic practices, and which they think is very effective. So this can be learned by people from Mozambique, from other countries.
Yeah. So, and previously Professor talked about the antiviral treatment, and now she's talking about the antibacterial treatment. Because COVID-19 is a virus. Why in sometimes we have to use the antibacterial treatment is because when people get infected with virus, you might have a secondary infection of bacterial infection. In this case, you might use antiviral and at the same time with antibacterial medicines.
So this is a complicated scenario.
Complicated scenarios. So you are infected with virus, and later on you are infected with a bacterial infection.
Infecção bacterial temos
But we have to avoid the inappropriate use of antibiotics.
对于这种抗菌药物的使用呢，也是建议对患者进行分层的管理。如果只是轻度的这种细菌感染，优先考虑口服的药物；如果有中度以上的这种症状、体征或者是炎性指标明显升高的，考虑给予静脉的用药。但重症和危重症或者严重的细菌感染呢，你就一定要强力的这种抗感染，往往是一个联合的进行治疗。
Para os infecção leve, podemos tomar medicamentos oral e para os médicos podemos tomar.
So the choice of the antibiotics needs to be depend on the severity of the bacterial infection. So for mild bacterial infection, we might choose oral antibiotics. But for patients with a mild fever, they have respiratory symptoms, you might consider intravenous use of antibiotics.
同时的话，对于危重症的患者，还要谨记这个真菌的感染，并且我们要力争在治疗。
So this is another scenario. So if the COVID-19 patients with critical conditions, you are infected with not only the virus but also the bacteria, and you get infected with fungus, and then you might use too many drugs and too many side effects. So that's why we need many experts from different departments to come and sit together to discuss how to treat so many different diseases within one patient.
Yeah, this involves the interdisciplinary experts to work together.
Yeah, interdisciplinary experts.
Here, apparently, still some key takeaways for treating COVID-19 patients. Can you explain a little bit?
So now it's the principle of treatment. So we need to actively treat the patients to prevent the complications to develop. We need to
The most basic starts from the basic symptoms.
start from the basic symptoms.
Yeah. And also take good care of those severe symptoms, like they previously said, just to transferring them to ICU for intensive care.
Yes, especially for severe cases. If they develop critical conditions, they might be transported to the ICU for ventilation, or even with ECMO support, or even with dialysis support.
E o apoio respiratório é muito importante. Normalmente nós tomamos oxigenoterapia e oxigenação por catéter nasal.
So on top of the principles there, to ensure the adequate oxygen supply, to make sure they breathe freely, right?
Yes, so we have accumulated a lot of experience from treating the patients with critical conditions. We have sent doctors, experts from ICU from Western Hospital to Wuhan to treat these critical patients. So the ventilator and the ECMO are very important.
So ECMO, this only applied to those with severe symptoms.
Especially for them, they cannot breathe with critical conditions, so they need to be supported with ECMO. So because the ECMO is very expensive medical devices, so during this time when we send our doctors to Wuhan, we also send our ECMO to Wuhan to help the patients with critical conditions.
And I know that some scientists and experts are really utilizing their ingenuity to develop their own type of ventilators. Some of them are very economical, they can be put into mass production immediately. So this is a very good way. I mean, this is a process of engaging the general public to invent this kind of effective equipment.
Yes, it is, especially because now we know from the report that worldwide 1 million confirmed cases and almost 50,000 deaths. So we need the ventilator, we need the ECMO to save the patients with critical conditions. So there are many different treatment options and how to use them efficiently. We need to so we need the opinions from different experts and try to have an individualized treatment plan for a specific patient. So maybe one patient, one treatment plan is different.
And now I think the expert is talking about hormone usage. So what do you think are the key points here? Is it acceptable to use a hormone in treating COVID-19 patients?
So they are talking about the corticoids use for the treatment of COVID-19. So it's a disputable topic. Some experts suggest that the severe patients might use the corticoids to reduce the symptoms. But some experts do not support the use because if you use it, you might increase the chances of getting bacterial infection or fungus infection. So then whether this patient need to use corticoid is a disputable topic.
Yeah, I think this training session is very practical because it involves all the possible outcomes of using different ways to treat COVID-19 patients. And some of the issues are yet to be discussed and finalized, whether it's proved to be the final cure for this disease, right? Because many of them are actually the result after different rounds of trials by medical staffs here, right?
Yeah, that's right. We're still accumulating experience to optimize the procedures or optimize the treatment plan to increase the treatment efficiency.
Now it's talking about the discharge standards. So under what situation a patient will be discharged from hospitals?
So they're talking about two different discharge criteria. The first one is for the suspected patients, the discharge criteria, and the second one is the confirmed patients.
So for the suspected patients, there are two criteria. First, it's never been tested positive with a nucleic acid test. And the second, for 2 consecutive times they tested negative, and then they can be discharged, right?
Yes, for the 2 times negative test, and then should be within
an interval of 24 hours.
And the interval should be at least 24 hours.
Okay.
Interval.
So what about for the confirmed patients?
For the confirmed cases, so if they are treated in an isolation ward, if their temperature goes back for 3 days, have a normal room temperature for 3 days, and their respiratory symptoms getting better, and the third important criteria is for the imaging showing then their CT scan have been obviously improved. And the most important is still the nucleic acid test. They had, like the suspected patients, they need 2 different tests to show that they become from positive to negative. And also the interval has to be at least 24 hours. And the last one is that you see, even for the samples from the respiratory symptoms, respiratory samples for the nucleic acid test negative, you might also need to test the feces. Fecal sample.
So there are 2 different samples, first taken from the respiratory samples, like a saliva and a certain type of mucus, right?
Yeah,
it's kind of and then the feces test for both of them until they tested negative, they can be discharged. Yeah, this is very important. This is the extra efforts after patients were discharged from hospitals. There are several cautions should be paid.
Even now you can see that our country has issued the 7th protocol for the diagnosis and treatment of COVID-19. So it's already the 7th version. So different version, the procedures or the criteria might be changed.
And also here, the Chinese medical experts suggest they will continue with a 14-day quarantine period. Yeah, they can stay in isolation, right? Now, this part of the training session has been shared by Ms. Tang Hong, the director of the Center for Infectious Diseases of West China Hospital of Sichuan University. I think next is a very brief Q&A session, right? The experts, the medical staff working at Maputo Central Hospital is now having a Q&A session with experts here in China. Let's check out briefly what the most concerned problems are.
我们现在请这个李大江部长来对相关的这个马普医院方面提出的这些问题进行解答。
And now the West China Hospital is now inviting Mr. Li Dajiang, the head of this COVID-19 treatment and prevention team here at West China Hospital to answer several questions as posed by the Mozambican counterparts.
好，我来回答这个莫桑比克各位专家提出的前3个问题。
And
是麻醉
before and during this training session, the medical staff in Mozambique has submitted a list of questions, and now Mr. Li is now answering one by one. So, can you brief us a little bit about some of the questions?
So I think the doctors from Mozambique, they have asked 8 questions. And now Professor Li is asking the first 3 questions. The first question is about during the anesthesia and how the patient with confirmed COVID-19, how can the doctors to make precautions to protect themselves? And so Professor Lee said that during the process, they need to guarantee that each single COVID-19 patient get one equipment. So they should
So
not.
for one case.
For one case.
Okay.
So for
one
instance,
equipment for one case.
or for one case.
Okay.
So after
for safety
that,
concerns.
For safety concerns, and after that, the equipment need to be thoroughly disinfected after the anesthesia.
I think this is a normal procedure after each operations, right?
Yes, so then we'll have to stick to it.
Okay. So anything else?
麻醉诱导前的给氧要使用2块瓷纱布将患者口鼻盖上，以
I
面
think
让
the
工作
second
人
and
员
third question is also about the anesthesia procedure, and how to guarantee the safety of the anesthesiologist.
So those patients tested positive.
Tested positive.
How to conduct
How to conduct
anesthesia.
the anesthesia procedure to make sure that the doctors
Yeah.
themselves not get infected. I think these questions already be answered during the presentation.
建议采用快诱导的充分集中后的气管插管，避免降科。另外的话，就是90秒后的话，确保自主呼吸完全消失后的话，再进行插管。插管前应避免先吸痰。
Se é como só permitir meta-se a intubação traqueal após a intubação rápida.
I think they mentioned that before the airway intubation, they should avoid the sputum suction to avoid the infection.
A respiração autônoma desaparece completamente e depois faz a intubação.
尽量在深肌松下的吸痰，建立气管导管后的话，采用封闭式的吸痰管进行吸痰。
É melhor tentar aspirar a flema no músculo parassônico profundo e após estabelecimento.
They suggested that after the anesthesia procedure, after the induction, the sputum suction should be conducted after that.
避免交叉感染。新鲜的气流量要高于每天的空气量。建议静脉维持使用。吸入时应注意吸入麻醉，不要加深过快。
Todos os pacientes devem ser filtros de caixa respiratório para evitar a infecção cruzada. O fluxo de ar fresco é superior ao volume de ar.
I think the expert here at West China Hospital has just given almost all of the practical suggestions. So, Professor Lee, I want to ask you, so based on your personal experience, what do you think in Mozambique's case, specific case, what suggestion would you give to the country to cope with the COVID-19?
I think for the Mozambique doctors, I think currently they have only 10 cases of confirmed cases of COVID-19, but now they are connecting with us to discuss how to prevent and how to control. I think it's a very good sign because I think today with training from West China Hospital, we discussed the policy and how to regulate in the hospital, how to educate the patients. We also talk about the diagnosis and treatment and also proper isolation of patients. All of these measures can efficiently help the Mozambique to prevent and control the disease.
Okay, thank you so much for your very useful suggestions. I think this training session will be continued during the following days, right? Not only in Mozambique and in other countries. And we hope we can keep an update on that. Thank you, Professor Lee.
My pleasure. Thank you.
Actually, according to China's Health Commission, there are now around 1,000 Chinese medical experts working in Africa, providing necessary medical support and help treat local patients. And since after the outbreak of the COVID-19 cases across the world, the Chinese medical experts in Africa have helped organize more than 200 health-related programs, and they have also trained more than 10,000 local staff in Africa. And also China is now stepping up its efforts to joining the global community in coping with the COVID-19 cases by sending medical experts and by providing more medical supplies. that side, I think we come to the end of today's live streaming. I'm reporter Meng Qingsheng here in southwest China's Chengdu city. See you next time. And thank you, Professor Li. Thank you.
My pleasure.